Hello everyone, welcome to GrowMed. तो we'll discuss a few important points needed for the FMG exam. बहुत सारे स्टूडेंट्स की क्वेरीज रहती है कि कहाँ से पढ़ना है, कैसे पढ़ना है, किस सब्जेक्ट में कौन से टॉपिक पे ज़्यादा ध्यान देना है. So we'll discuss everything one by one. तो in this video we'll discuss the must topics for the ENT subject. So from ENT there are 12-13 questions being asked every year and mostly ENT का ऐसा है कि all of the questions they have been repeating continuously. तो अगर PYQs पे देख लेंगे ना तो ज़्यादातर चांसेस है कि ENT के MCQs आपके सारे सही हो जाए. अगर किसी ने ENT पहले से पढ़ा नहीं है and they do not have time to read the whole subject, then you can do all these topics very thoroughly. Look for the PYQs related to these topics, what kind of questions are asked. So let's discuss the topics. First we discuss the topics coming from the nose. Nose is also a very important topic. We need to know the anatomy of the nose. कि कौन सी anatomy of the nose कि nose किससे बना हुआ है, how much bone, how much cartilage, 3 kinds of cartilages are there. तो ये anatomy भी nose की बहुत ज़्यादा ज़रूरी है. Then epistaxis means bleeding, nose bleed. तो ये किस artery से होती है? That is sphenopalatine artery. और ये कहाँ से ब्लीड होती है? लिटल्स एरिया में से ब्लीड होती है. लिटल्स एरिया में केसर ब्लैक प्लेक्सस रहता है और वहाँ से ये यूमैक्स एरिया और वहाँ से ये ब्लीड होती है. सो दिस वन इज ऑल्सो अ वेरी इंपॉर्टेंट टॉपिक एंड frequently asked questions from the FMG. Blood supply of the nose. The nose is supplied mainly by the internal carotid artery and the external carotid artery. internal carotid artery की branches और external carotid artery की branches बहुत ज़्यादा ज़रूरी है एंड इसकी branches से ही एक plexus बनता है. Kessel back plexus fracture is the most common fracture of the face. Question पूछा गया है and also देख लेते हैं यहाँ पर most common face fracture is the nose fracture, as well as we need to see the management of the nose fracture. Management जो है, there are two components of the management. If there is edema present and edema absent. Edema present or absent. After the edema subsides, we will do the reduction after the 7 days, and if edema is absent, then immediate reduction. Reduction. So these are the questions asked based on the nose fracture. Then another very, very important topic is X-ray views for the sinuses. The X-ray views for the sinuses are the Waters view, Peary view, and Cadwell view. Image-based questions are must do topic. You need to look at the and you need to look for कि किस व्यू में कौन सा साइनस देखने को मिलता है. जैसे कि वाटर्स व्यू, इन द वाटर्स व्यू वी कैन सी द maxillary sinus very clearly, and then for the Cadwell view we will see the frontal sinus very clearly, and Peary's view में sphenoid sinus अच्छे से दिखता है. So these are the ones you need to do. Then atopic rhinitis. Atopic rhinitis is also a very important topic and seen mostly in the female. इसकी clinical features याद रख लेना, जैसे कि roomy nose, nasal obstruction, merciful anosmia, and then it causative organism caused by Klebsiella ozonii. और इसकी ट्रीटमेंट के बारे में ऑलवेज जैसे क्वेश्चन आस्क दैट इट्स यंग ऑपरेशन. क्लिनिकल बेस दे देंगे कि फीमेल आई है डिस्टर्ब roomy nose, then false smelling discharge, merciful anosmia, what is the treatment of choice? So it's like a Young's operation. Or it is also one like asked कि atopic rhinitis की treatment of choice क्या है? Then the answer is Young's operation. Then आगे बढ़ते हुए rhinoscleroma. So rhinoscleroma की causative agent Klebsiella rhinoscleromatis. Then इसकी 3 stages है, atrophic, granular and fibrosis. इसकी यूजुअली जो बहुत फेमस प्रेजेंटेशन है ना वो है बॉडी नोज क्वेश्चन. देन इसमें दो फाइंडिंग्स भी देखी जाती है. 2 फाइंडिंग्स we can find on the histopathological examination, the Michelin cell and the Russell bodies. One liner पूछा गया है कि Russell bodies are found in Russell bodies and Michelin cells are found in. Answer was rhinoscleroma. राइनोस्पोरिडियोसिस के बारे में क्वेश्चंस आते हैं उसके पॉजिटिव एजेंट को लेके. सो पॉजिटिव एजेंट इज राइनोस्पोरिडियोसिस सीबेरी. तो क्वेश्चन ये भी पूछा गया था कि व्हाट इज सीबेरी क्या है? तो सीबेरी एक एक्वेटिक प्रोटोजोआ है. ओके, देन क्लासिकल फाइंडिंग ऑफ राइनोस्पोरिडियोसिस इज द स्ट्रॉबेरी ग्रैन्युलोमा. इसकी क्लासिकल फाइंडिंग है और इसके ट्रीटमेंट के लिए यूज करते हैं टैप्सोन. ओके, तो ये होगा राइनोस्पोरिडियोसिस के बारे में कुछ इंपॉर्टेंट पॉइंट्स. inverted papilloma is the tumor of the nose. Questions आते हैं from where it arises from the lateral wall, and what kind of tumor it is. It is a benign tumor, but it is invasive. Questions have been asked that what kind of a tumor is inverted papilloma, and the answer was benign and invasive. The investigation of choice is the histopathological examination and the treatments. What treatment we will do for the inverted papilloma is the medial maxillectomy. Squamous cell carcinoma of the maxillary sinus, इसमें stages पूछते हैं. Let us, and the most famous question of this maxillary sinus is or identify prognosis of the cancer. So the most important, very very important question is pharyngeal carcinoma. Pharyngeal carcinoma के बारे में they can ask the clinical features, मतलब एक clinical case type का ही लिया जाता है कि elderly male with neck swelling. So neck swelling is its most common clinical presentation too. Neck swelling के बारे में nasopharyngeal carcinoma के लिए radiotherapy. तो choanal ectasia is a complaint of a pediatric में ये देखने को मिलता है. Pediatric complaint, baby which turns blue, baby turns pink on crying, ये इसकी classical वो रहेगी. Baby turns pink on crying, this one will be a piece of a cake for you. Like ये क्वेश्चन में अगर दिया गया हो, then the answer will be choanal ectasia. ठीक है. Then the management of this will use a wide bore nipple, and the technique is called as Metz-Grogan technique. CSF rhinorrhea most common cause is trauma, और trauma की वजह से जो साइट है फ्रैक्चर होता है वो simply from plate. तो यहाँ से फ्रैक्चर होगा तो CSF लीक करेगा और ये नोज में आएगा. तो डिफरेंशिएट कैसे करेंगे कि जो म्यूकस है नोज का वो स्टिकी रहेगा एंड CSF इज नॉट स्टिकी एंड इट इज क्लियर. तो इससे हम पता लगा सकते हैं. ओके. देन गोल्ड स्टैंडर्ड टेस्ट इज आस्क्ड. Question asked about the gold standard test for the CSF rhinorrhea. It is beta 2 transferring test. So beta transferring test is a gold standard test for the CSF rhinorrhea, and a classical finding present in this is when there is traumatic CSF growth, we will find a handout sign. Image based question की फॉर्म में दिया जा सकता है that bloody. तो क्वेश्चन हैव बीन आस्क्ड कि हेलो साइन इज सेम ए. तो क्वेश्चन में CSF rhinorrhea भी रहेगा, ऑप्शन में CSF rhinorrhea भी रहेगा, ट्रॉमेटिक CSF लीक भी रहेगा. ट्रॉमेटिक CSF लीक को सेलेक्ट करना है. हेलो साइन ए. Then another question asked is the investigation of choice. Investigation of choice for the CSF rhinorrhea is the HRCT. So this was the important points related to the nose topic, or repeatedly asked about these topics. Now supply of the larynx. The larynx is mainly supplied by recurrent laryngeal nerve and superior laryngeal nerve, a branch of vagus nerve. Superior laryngeal nerve is again classified into the external laryngeal nerve and the internal laryngeal nerve. Its nerve supply is very important. Superior laryngeal nerve supplies which parts, and recurrent laryngeal nerve supplies which parts. The recurrent laryngeal nerve supplies mainly the subglottic area. Subglottis mainly supplied by the recurrent laryngeal nerve, and the internal laryngeal nerve supplies the supraglottic area. Supraglottis and the glottis, which is the true vocal cord, is supplied both by the internal laryngeal nerve and the recurrent laryngeal nerve. Then moving on to the muscles of the larynx. Muscles of the larynx, favorite question of the FNG is what is the only abductor of the vocal cord? Only abductor of the vocal cord, the posterior cricoarytenoid node. We need to know other muscles, also the abductors and the tensors and the muscle supplies. Which muscle is supplied by which nerve? Another very repeatedly asked questions related to the muscles is the nerve supply of the cricothyroid. Cricothyroid is supplied by the external laryngeal nerve. An important topic is the laryngocele. Laryngocele questions have been asked based on the image-based question and even the clinical case. Like a question is given, a history is given that a patient presents to you with a swelling in the neck, and X-ray is given, and he gives a history that he's a trumpet blower. So history is trumpet swelling present. It is an abnormally dilated saccule, and treatment of this will be surgical incision. So usually image-based question, and they will ask the diagnosis of the laryngocele. Okay. Then another important pediatric question, the laryngomalacia. Laryngomalacia, the epiglottis will be omega shape. And there will be stridor paralysis. It is a congenital condition, and it will resolve by itself in 3 weeks, so we need to do nothing. Only a conservative management is required for this. And image-based question is usually asked. Malaysia की image-based question दे देंगे and they'll ask you to make the diagnosis. So इसकी images देख लेना. Then acute epiglottitis is also a pediatric problem. Integrated वे में पूछा जा सकता है pediatric से related भी. Image-based question दे देते हैं X-ray की, और X-ray में क्या finding मिलती है? We can see the thumb sign. रेडियोलॉजी में भी इंटीग्रेट करके पूछा जा सकता है. एक्सरे में हमको थंब साइन देखने को मिलता है. एंड द पॉजिटिव एजेंट विल बी द स्ट्रेप्टोकोकस pneumoniae एंड सेकंड पॉजिटिव एजेंट कैन बी द हेमोफिलस इन्फ्लुएंजा. केस टाइप क्वेश्चन भी बना के दे सकते हैं. अ चाइल्ड presented to the emergency with fever, sore throat, dysphagia and dyspnea, and X-ray was performed. You can see the thumb sign. So what is the diagnosis? So answer will be acute epiglottitis, or they can give the image-based question. The sign seen. Identify the sign, thumb sign seen in the acute epiglottitis. Then moving on next to the croup, also called as acute laryngotracheal bronchitis. It is also a pediatric condition caused by a parainfluenza virus. It is also a pediatric patient and the positive agent is the parainfluenza. One-liner ये पूछा जा सकता है. What is the positive agent of the croup? और clinical question दे देंगे कि child presents you with barking cup and biphasic stridor. So what is the diagnosis? And the diagnosis will be croup. Then we will see that finding seen on the X-ray is the cerebral sign. Image-based question being asked integrated with this radiology, and another important finding of this is we can see the biphasic stridor in this. And the treatment is symptomatic treatment करेंगे, humidified oxygen देंगे, bed rest, steroids and antibiotics. This one is a treatment के बारे में भी questions पूछा गया है कि clinical case दे दिया, diagnosis was made of croup, how will you manage this patient? तो oxygen देंगे, humidified oxygen, फिर स्टीरॉइड्स देंगे, फिर एंटीबायोटिक्स देंगे. कंजर्वेटिवली हम इस पेशेंट को मैनेज करेंगे. अनदर इंपॉर्टेंट टॉपिक इज जुवेनाइल ऑनसेट रिकरेंट रेस्पिरेटरी पैपिलोमाटोसिस. द पॉजिटिव एजेंट इज द HPV 6 and 11 and treatment. What we need to do the treatment for this one? It will be microlaryngeal surgery with the CO2 laser, and if there is recurrence we will use intralesional steroids for this. So another important topic asked from the larynx is the laryngeal carcinoma. Larynx cancer. Mostly cancer के staging के बारे में questions पूछे जा सकते हैं. T1, T2, T3 and T4 stages ना, कि vocal cord fixed है, vocal cord कितने structures involved है, और treatment of choice is asked for the laryngeal carcinoma. So it is also a must-do topic. And other topics are the vocal nodule image-based question पूछा जा सकता है, vocal polyp image-based question पूछा जा सकता है, intubation granuloma. So these were the important topics related to the larynx. Now moving on to the pharynx. Pharynx से related जो हर साल question पूछा गया, that is adenoid hypertrophy, a very very important. I would give a star mark कि इसको बिना करे जा ही नहीं सकते एग्जाम में. Adenoid hypertrophy caused due to infection, and there will be a presentation की child है and it is mouth breathing and adenoid faces. If this comes, you cannot miss the question. The answer will be adenoid hypertrophy and the treatment will be adenoidectomy. Mouth breathing and adenoid face, a classical findings of this adenoid hypertrophy, and you cannot miss this question if these clinical features are given. Also adenoid faces, they can be image-based questions given. A child who is breathing with the mouth, and due to this there will be overcrowding of the teeth, upper teeth, maxillary teeth जो है they become overcrowded. ठीक है, तो ये भी एक piece of take है पहचानने के लिए कि एडिनोइड हाइपरट्रोफी का केस है. देन इसकी ट्रीटमेंट है कि हम एडिनोइडेक्टोमी करेंगे. एंड यूजुअली एडिनोइड हाइपरट्रोफी से रिलेटेड ईयर ऑब्स्ट्रक्शन भी होगा, जिसकी वजह से ईयर की प्रेजेंटेशन क्वेश्चन में दी गई होगी. तो इफ देयर इज ब्लू ईयर प्रेजेंट, देन द ट्रीटमेंट विल बी Dactyl plus Cormet incision. This one is the treatment, and they've been asked questions about the adenoid hypertrophy, its management, its clinical features, its image-based questions. So it is a must topic. Then another very very important question, the angiofibroma. Angiofibroma most commonly seen in the adolescent boys, and the symptoms will be epistaxis, recurrent epistaxis with a nasal mass present, and on CACT, which is the investigation of choice choice the CECT, and on CECT you can see a finding Holman-Miller sign. Treatment is endoscopic excision, and also frog face deformity is seen in this angiopharyngeal. In the next topic, the nasopharyngeal carcinoma. Causative agent of the nasopharyngeal carcinoma is the Epstein-Barr virus. Site fossa of Rosenmiller. Repeatedly question being asked on the fossa of Rosenmiller. Image-based question is also asked, and nasopharyngeal carcinoma arises from. The answer will be fossa of Rosenmiller. It is a squamous cell carcinoma, and clinical features is cervical lymph. And the clinical feature will be the neck adenopathy, secondary neck node. There will be unilateral blue ears due to which there will be conduction hearing loss. Also, total striate is seen in the nasopharyngeal carcinoma. On the components of this are the injury to the cranial nerve 5, cranial nerve 10 involved, and conductive hearing loss. These three components make the total striate, and a question asked total striate is seen in, or what are the components of the total striate. Then treatment of this nasopharyngeal carcinoma is chemoradiation more than chemotherapy. Chemoradiation we prefer first, then we will try the chemotherapy. So this was about the nasopharyngeal carcinoma. Another important topic is the quinsy. Quinsy, other name is peritonsillar abscess. Peritonsillar abscess. It is a unilateral condition, and the vulva or the tonsil will be pushed. The tonsil will be vulva will be pushed to the medial, and there will be swelling. Unilateral tonsillar. And usually image-based question have been asked in the quinsy. इमेज दे देंगे vulva की जो deviate हो गया है, and they'll ask you to make the diagnosis. So the diagnosis will be quinsy. When Ludwig angina usually asked image-based question, neck की image दे देंगे और neck के नीचे swelling रहेगी. Ludwig angina, that will be the diagnosis of the Ludwig angina. Then rectopharyngeal abscess due to infection of the lower lymph node. Lower lymph node, or X-ray में is finding widening of the prevertebral shadow. Usually patterns से related ये वाले questions आते हैं exam में, and most commonly every year the repeated question is angiopharyngioma, nasopharyngeal carcinoma, and adenoid hypertrophy. So moving on to the ear topic. Ear topics से भी there are questions being repeatedly asked on the same topic. So start करते हैं malignant otitis media. Most commonly seen in the diabetic patient or immunocompromised patient, and causative agent is the Pseudomonas. Causative agent is Pseudomonas, and cranial nerves are usually involved in this condition, and most commonly is the cranial nerve 7. So questions are asked based on these. And the treatment investigation of choice is bone scan, and treatment third generation cephalosporins. Then the other topic is serious otitis media, also called as secondary otitis media, also called as flu ear. Causative a reason for a conductive hearing loss in the patient. Then treatment पूछा जा सकता है. Treatment will be myringotomy plus Gourmet incision. Then acute mastoiditis, image-based question is asked. Swelling over the mastoid region behind the ear, mastoid region में swelling देखने को मिलेगी, and there will be signs describing it like the reservoir sign, ironing of the mastoid surface. It is a complication of the ASOM, acute suppressive otitis media, and chronic suppressive otitis media. Then treatment will be the cortical mastoidectomy, which is called as a Schwartz operation. These were some points related to the acute mastoiditis. What is the bezoid abscess? Bezoid abscess is the abscess seen in the sternocleidomastoid muscle, and it is also a complication of the chronic suppressive otitis media. Suppressive otitis media classified into the acute and the chronic. We need to look for the features of the acute and the chronic otitis media. The positive organism, which are the Streptococcus pneumoniae, acute की Streptococcus pneumoniae है. Then mainly इसके complications पे ध्यान देना, because question is asked mainly on the complications. Then another topic, the venous. This is very important topic. It is due to the damage to the cochlea. Cochlea के damage की वजह से, due to because of hyperkalemia. इसमें ट्राइएड देखने को मिलता है. venous disease पे ट्राइएड याद कर लेना. That is tinnitus, vertigo, and hearing loss. And a very classical sign seen in this venous disease is the diplacus. And recruitment phenomenon भी इसमें देखने को मिलता है. PP, benign paroxysmal positional vertigo. क्वेश्चन में ही सब कुछ बताया गया है कि ये बिनाइन कंडीशन है, इसमें वर्टाइगो होता है, पेशेंट कंप्लेन करता है वर्टाइगो की. ठीक है, ये पैथोलॉजी है इसकी डिस्प्लेस्ड ऑटोकोनिया. किसमें? सेमीसर्कुलर कैनाल, यूजुअली पोस्टीरियर सेमीसर्कुलर कैनाल में ऑर्थोकोनिया चले जाते हैं. देन इन्वेस्टिगेशन के लिए डिक्स हाल्पिक मेथड एंड ट्रीटमेंट के लिए एप्लीज मैन्यूवर यूज करते हैं. इमेज बेस्ड क्वेश्चन पूछा जाता है. दिस इज 2 स्टेप एंड दिस इज मोस्टली 6 स्टेप प्रोसीजर. ठीक है, तो इसको देख लेना एक बार. बाकी नेक्स्ट इज द ओटोस्क्लेरोसिस. ओटोस्क्लेरोसिस में जो है यूजुअली अ फीमेल की हिस्ट्री दी जाएगी. अ फीमेल or a physical symptom of this is it increases in pregnancy. There will be bilateral conductive hearing loss, and the sign seen in this is the Praxis Bilsi. In is the Schwartz sign, and also on your stone audiometry we can see a notch at 200 2000 people. So that notch is called as a cathedral notch. Image based question में आ सकता है. तो ये जो है they can ask as a clinical feature. And the treatment of the otosclerosis is steroidectomy. Very, very important. The next is the glomus jugulare, a benign, highly vascular tumor arising from the jugular cells. Presenting with the pulsatile tinnitus and the red mass. This condition also more common in the females. Clinical case के तरह पूछा गया है in the previous years. Pure tone audiometry graph दिए जा सकते हैं image based question पे. 2 notches इसके रिलेटेड, 2 डिप्स इससे रिलेटेड बहुत ज़्यादा ज़रूरी है. नॉच एट 200 डिप्स, नॉच एट 200 and at 2000 and 4000 hertz. And then on the audiogram we can come to know if it is sloping audiogram, presbyacus and venous. This is shows raising audiogram. And also another test required in this are the Riener's test, then tympanometry graph, जिससे टिम्पैनिक नेबुलर ऑसिकल्स की फंक्शनिंग को हम देख सकते हैं. टाइप ए बी सी है इसमें, और एएस और एडी है, तो वो भी बहुत ज़्यादा ज़रूरी है. एएस ओटोस्क्लेरोसिस में दिखता है, जो कि हर साल पूछा गया है, रिपीटेडली पूछा गया है. एंड ऑल्सो इन चिल्ड्रन व्हाट वी यूज फॉर स्क्रीनिंग इज द OAE टेस्ट. एंड ऑल्सो टेस्ट फॉर ऑडियोलॉजी जैसे कि ट्यूनिंग फोक, रीनस टेस्ट से भी पूछा गया है क्वेश्चन. सो ऑडियोमेट्री, ऑडियोलॉजी के जो जितने भी सारे टेस्ट हैं ना, आई सजेस्ट टू गो थ्रू ऑल दोज थरोली. देन ईयर की एनाटॉमी भी बहुत ज़्यादा ज़रूरी है. एंड ऑल्सो द नर्व सप्लाई इज इंपॉर्टेंट. पिन्ना में यूजुअली 3 नर्व्स सप्लाई करते हैं, ऑरिकुलर टेम्पोरल, लेसर पेट्रोजल, एंड एक्सटर्नल ऑडिटरी में वेगस का ब्रांच फिर फेशियल नर्व सप्लाई करता है. एंड ऑल्सो द नर्व सप्लाई ऑफ द टिम्पैनिक मेम्ब्रेन. Auricular temporal nerve, Arnold nerve supplies the tympanic membrane, and also the Jacobson's nerve. The nerve supply is also a very important topic. And also I suggest you to go through the anatomy thoroughly, because anatomy clear रहेगी तो बाकी दूसरे concepts भी अच्छे से clear हो जाएंगे. So this was a video to focus on the topics repeatedly asked in the FMG exam. Thank you guys for watching this video. Please share it with your friends, and if you find it useful, like and subscribe to my channel. Thank you.